Hello guys, and welcome back to another episode of Health Talks on this YouTube channel, Nancy Wansila. And to my new subscribers, karibuni sana. And if you're watching the video and you haven't subscribed, kindly subscribe, like, and watch the video up to the end. In today's video, we will be talking about danger signs in pregnancy. Now, these are the danger signs which can happen during pregnancy. Number one is vaginal bleeding. Vaginal bleeding can happen during the first trimester. If it happens, it can be due to implantation, but here it won't be really bleeding, but what we call spotting. Or kwa spotting, the blood is normally light. There may be visible clots, and the floor is always very light. Now, on the same danger sign, vaginal bleeding, there may be that vaginal bleeding which can be accompanied by cramps or maybe not. Here, the blood is normally dark. There may be visible clots, but hiyo flow utoka uanza kidogo ikiprogress. So in case you see any of this, whether it's spotting ama real vaginal bleeding, kindly visit your healthcare provider. The second one is extreme nausea and vomiting. Remember, nimesema extreme, not just the normal morning sickness. Whenever this extreme vomiting or nausea occurs, the mother may be unable to feed very well, and the mother can be at risk of dehydration, loss of weight, kwa sababu maybe she's not feeding very well, and maybe poor gain of weight for the fetus. Zile kilo mtoto hata ongeza weight. If it happens, kama you are extremely vomiting or kuna hiyo nausea, please visit your healthcare provider ndio upate usaidizi. Usione alafu just relax. We also have extreme swelling of your face, of your hands, of your limbs. If it happens, remember nimesema extreme. If you notice such, kindly visit your healthcare provider, because if it happens, it can be maybe due to preeclampsia. Let me maybe talk about this preeclampsia juu maybe mwenye naongea na yeye hata aelewi nini. Let me just elezea about it. Preeclampsia is simply just the rise of blood pressure. Inaweza happen during the second trimester towards the third trimester. If there is that extreme swelling of your limbs, miguu, mikono, uso, uta notice too, it's your normal. Just visit your healthcare provider. First, they'll check your blood pressure. They'll also do urinalysis to check the presence of protein in urine. Remember, haifai kuwe na hiyo presence of protein in urine. When they check the blood pressure and the urine, presence of protein in urine, in case upatikane na ziko juu ama there is presence of urine there is presence of protein in urine, you will be managed. Huwezi enda hospital nyumbani. Is can lead to very serious complication to both the mom and the unborn baby. So make sure in case of umefurafura tu, unaona tu ni abnormal, just make sure you go visit your healthcare workers here. Kwa sababu if utaenda hospitali, you know this thing, kuna that rise in blood pressure na ijakuwa maybe you have not visited your healthcare provider. So remember, haijakuwa managed na ishaanza kupanda. Inaweza kuwa severe na itoke from pre-eclampsia iende nao kwa eclampsia, where sasa blood pressure itakuwa iko juu. Sasa kujaribu kuicontrol, uirudishe to the normal side, itakuwa tena ni kazi nyingine. So usikae nyumbani na hizo vitu, usikae nyumbani na hiyo kitu, usikatae kwenda hospitali. Just go to the hospital. Ukinotice tu, enda kwa hospitali. It will be managed by your healthcare provider. Have also extreme fever during pregnancy. Inje sasa ni abnormal. If it happens, it can be due to maybe a viral or bacterial infection or even malaria. Maybe this mama, maybe aulali ndani ya neti. In case you notice this, just visit your healthcare provider. We have also dizziness of fainting during pregnancy. Most mamas, where they complain a lot about it. So if it happens, just visit your healthcare provider, because maybe it can happen because maybe you are not feeling well. Thus, kuna low blood sugar levels in your body, and maybe due to low blood pressure. So in case you are experiencing this, just visit your healthcare provider. Watakucheck waone kama uko sawa. If you are not okay, you will be managed very very well. The other one is kuka pale. How will you notice? Utajuaje kama uko pale? Maybe ukiangalia hapa chini ya jicho hapa, unaweza angalia mikono, but it will depend na the climate. Kama unakaa mahali kuna baridi sana, hiyo inaweza interfere, but chini ya macho uta notice tu this is not your aukai normal. Kuna hiyo pale hata huku kwa chini ya huku kwa kucha, ulimi. This can be an indication of anemia. Anemia ni normally your HB levels huwa ziko chini. So when you go to the hospital, they will be able to check, they will be able to do some blood test, waone kama your HB levels ziko sawa, and it becomes a danger sign because maybe your HB levels ziko chini. Unajua hapa utapatwa na hizi severe headache, una feel dizziness, una faint maybe, there's low swelling of your limbs. If it happens, just go visit your healthcare provider and utasaidiwa. We also have persistent back pains ama abdominal pelvic pain. It can happen due to maybe tuseme uko na UTI, urinary tract infection. If it happens during the early stages, it can be a sign of miscarriage. Maybe itakuwa accompanied by cramps. Also, it can be a sign of preterm labor. Also, it can be a sign of placental abruption, where sasa placenta inajaribu kujidetach from the uterine wall. So if it happens, you see these are danger sign, hiyo preterm labor, miscarriage, hizo placental abruption, if it happens, just kama una experience that, just go visit your healthcare provider na utakuwa assistant, hence hautapatikana na shida yoyote. Yeah. The last one and the major one is reduced baby activities. Yeah, hiyo movement ya mtoi unajua venye mtoi alikuwa ana kick, sasa imereduce, si vile alikuwa ana kick. That movement here, whenever it reduces, it can be an indication kwamba maybe the baby is not getting enough nutrients or oxygen supply through the placenta. Maybe umekuwa ukiexperience zile severe back pains, na maybe it was an indication of placental abruption na ukwenda hospitali. So in case kuna that placental abruption, maybe si unaona the baby will not be getting enough nutrients, maybe enough oxygen. Now the baby activities zita reduce, na hiyo ni indication that mtoto wako hayuko sawa. So hizo vitu zote tumeongelelea, whenever you experience any of it, moja tu, we kimbia kwa daktari wako. Just go visit the nearby hospital and the healthcare workers there, they will help you. It can be also a sign, maybe inaweza kuwa ni kwa sababu ya maybe high blood pressure. Unakumbuka umekuwa ukiswell uso, mikono, miguu, and you did not visit your healthcare providers wakusaidie, hence blood pressure yako ishapanda. Sasa unaona ita affect mtoto, hence the activities za mtoi, hiyo kukik ita reduce. So whenever you see this, tafadhali kimbia ukaone daktari. Guys, that was our short video about danger signs in pregnancy. If you experience any of hizo zote tumeongelelea hapo, kindly visit your healthcare provider, alafu utasaidika. And in case you have any question, just ask the question on the comment section. I'll be able to answer them. And thank you guys for watching my video. Nawapenda sana.